All right, everyone, I think we're going to get started. So it is my pleasure to introduce Dr. Billy Koresh, Executive Vice President for Health and Policy at EcoHealth Alliance, and he will be giving our second keynote of the day, which will then lead into the panel, Adding Seats at the One Health Table, Promoting the Environmental Backbone at Home and Abroad. Thank you.
Okay, thanks, Alex. Thanks, everyone. There's always the big decision. Should you be polite and start for the people that are on time, or should we be polite and wait for all the people that are late? And I'm going with let's start with the people that are on time. So I kind of want to jump in, and the theme of today is this 21st century, One Health in 21st century, to get us thinking a little about moving forward. I know there are so many important problems from the 20th century that are unresolved, and we do know that One Health approaches can contribute a lot to problems we had in the 1900s and the late 1900s, and just improving some of those approaches that were never really fully developed. But I wanted to kind of push us a little further on to thinking about this century. And so I'm just going to kind of run through a few examples just to stimulate some thinking for the breakout session and kind of as a lead-in for our panel members here that are going to follow me. So this is a map of emerging infectious disease events over the last 50 or 60 years. So you can look at this. And this is a very standard approach. It's certainly how I was taught in school, that you do good surveillance and monitoring, and you identify, where disease problems occur, and then you focus your efforts there. But it's really a rear-view mirror approach. It's about where problems used to be, where problems occurred before. There's no really underlying thinking about why that might be. It's just a historical map there. Instead of a kind of a forward-looking approach, which is what we've done with looking at the risk factors for new zoonotic diseases, and you get a different map. And this is done by looking at the underlying what correlates, so underlying factors, risk factors that align with where those emerging disease events took place, and then projecting forward about where those risk factors most prominent as a way to so-called predict where emerging diseases may occur. But it's really a relative risk map of that. So sometimes people tend to say, oh, we're going to predict outbreaks or predict EIDs. It's really about identifying risk areas. So when Dr. Bert mentioned today that we have a lot of data, but that we're not using it, that falls into this category because we used available data sets on population size, land cover, temperature, rainfall. There's a wealth of that information already available, but we normally don't connect it to emerging disease events because we're kind of stuck, at least I am, in that kind of pattern of how I was taught to say, oh, emerging diseases occurred here, so we should look there in those same places, thinking that it'll just recur over and over in the same places, instead of looking at the underlying risk factors. So when we do that, we see, when we map out the factors that align with emerging infectious diseases, for one, we see population, mammal diversity, change in land use, and then you can map those factors, the risk factors, instead of talking about a historical map of where interesting things have happened in the past. And we've kind of updated that using some new approaches and kind of refined it so you can actually get down to gridded data sets to 1 square kilometer for many of these different kind of risk factors or variables. We've looked at about 250 globally gridded data sets and figured out which ones kind of correlate the most closely with emerging infectious disease events. And another kind of way to look at that, this is from the Institute of Medicine's old categorization of drivers or risk factors for disease emergence. And when we look at all those historical emerging infectious disease events, you can start to look and see things in kind of terms that we think about: land use change, agricultural industry change, trade, travel and commerce, medical industry change, as really being underlying risk factors. And you can map these factors to think forward about where emerging infectious diseases may occur, once again, instead of always looking in the rearview mirror. And of course, that you don't have to live in a country where a disease emerges because we're all interconnected. So lots of you have seen all the maps of airline travel and ships at sea and all of that. But there's some things we can actually do now with a fairly simple math and looking at airline travel patterns or shipping patterns and actually do, once again, risk and probability tables for where a particular disease, or it could actually be a terrorist moving with a bomb, where they're most likely to land, so you can identify airports that are more at risk, areas of any given country, where they're more likely to arrive from, which airports they might move through, where they might end up landing. And so you can have some new techniques like this. This is a software application that's available publicly. Any of you can use it to look at how a disease might move from one part of the world to another part of the world. So we can actually do some prevention. Some of you might be familiar with African swine fever, which was thought to be an African disease of swine that has a natural reservoir in wild swine or wild pigs in Africa, but now is a big problem in the European Union. It was originally introduced kind of in Eastern Europe and Russia. Everybody thought it was well contained. It got into wild boars, and then a few months ago jumped all the way over to Belgium. Very long distance jump, a couple of thousand kilometers. People think, oh, maybe the wild boar carried it, but trust me, no wild boar took a 2,000 kilometer walk across Europe and got to Belgium. So that was clearly moved by people, an anthropogenic force. So we know that what people are doing around the planet are really driving the spread of diseases and the emergence of diseases, whether or not they're infectious or non-infectious. I, too, will speak way too much about infectious diseases. I'll just give you a warning. Some of the work, too, you can use those same techniques and look about climate change and future projections. So here's an example, and you can't see it that well, but this is for a virus, Nipah virus, which is the reservoir is a bat, a large fruit bat. And we looked at, well, where is that virus now, endemic? Where does it exist now? And think about some of the different climate change scenarios for the future. And so this is a projection for 2050 of what are the underlying factors, what are the natural factors, what are human factors that may allow for Nipah virus to exist in other parts of the world in 2050 under a different climate scenario. So what we end up seeing is the areas in red are higher risk for that virus to be able to get established, and areas in green are actually reducing risk. So what we see is where it's endemic now with climate change is going green. It'll probably be lower risk in the future with a very conservative climate change scenario, and a higher risk in other parts where it might be able to survive or exist. Now, some people might say, well, the reservoir bat doesn't exist in the Western Hemisphere, so this is crazy. But it's not so crazy if you know anything about alien invasive species and what's happened over the last 50 years. We have hundreds of invasive species now in the Western Hemisphere which didn't exist 100 years ago, and any of those could serve as a reservoir, or there could be new introduced species, especially with climate change, that could easily get established. So we're really trying to stimulate some thinking here about what the future might be, and start engaging people in the conversation, as the first panel talked about, into how we can start becoming prepared for that or preventing these things from happening. Climate came up again, and hopefully everybody's downloaded a copy of the U.S. government report from Friday. I only did that this morning, but I did take a look at it on the train. And so I think everybody's coming together on this thinking, and I'm not going to get into this. And this is actually a map from Dr. Nyamba, who's going to be on our panel coming up next. But we looked at that and looked at the Southern Oscillation events, or El Nino, maybe as something to get us thinking about climate change. It's different, but it might give us some clues about what might happen at a global scale when the weather changes dramatically or changes even slightly. And I kind of put in here some things that are actually non-infectious diseases, about fisheries collapses in the southern Pacific Ocean, I come from a wildlife background, so we see starving marine mammals, starving seabirds that link to the fisheries collapse. A lot of fish, small fish are used for poultry production, for fish meal, so it impacts that industry too, for chicken production. In the middle of the U.S., the southern part where you see it's a little wetter during an El Nino event, we actually have nutritional deficiencies in the whole calf crop for the United States. Most of the calf beef production in the U.S. comes from Florida across into Alabama, Mississippi, that southern tier before they go to feedlots. And because of the extra rain, the grass grows greener, and you get copper selenium imbalances, and you lose your calf crop if you don't give nutritional supplements. So there's things that are going on that are predictable and things we can anticipate. And another reason why about linking across sectors, because this comes out of the weather climatology sector, but it really has big health impacts for other stakeholders that normally don't get together and talk. So that's our kind of running theme. Of course, on the health side, the human health side, we're talking once again about zoonotic diseases and billions of people being infected every year. So we think that this One Health thing has great meaning for public health because of the disease side of it. But it's really, that's a small scale. And what came out on Friday about future of climate change, which I heard the news talking about over the weekend, was the economic impacts. And so for several years, this is back, we started this in 2005 with Steve Aldrich and Jim Newcomb from BioEra, and they came out with this first big graphics on cost, the cost of big outbreaks, the cost of pandemics. And I'm just going to keep showing this slide until somebody listens. So this is now 12 years I've been showing this slide, and I'm not going to stop. We keep adding on to the right. As the time goes on, we just keep adding new pandemics and outbreaks in the cost, because this is a big motivator, and I'm glad to see it in that climate change report, is we can talk about health, but only certain communities care about health more now than used to. But it's about money. And so when Dr. Bright was talking about the private sector, that's a huge stakeholder in our conversation about the future of our planet and the health, our shared health is also about economics and development. So we can see they have big, huge impacts. And if we do want to engage the private sector, the for-profit business sector, this is the conversation they're interested in having because they have a lot at stake. And we need to really engage them more. Now, Catherine Chalaba, who you heard from earlier, kind of did this breakdown about where are those costs. So when you have $50 billion cost of an outbreak, the medical cost, the public health sector cost is really very small. So you see the little doctor's bag up there, kind of, and those are not exact numbers, but it's a kind of a relative ratio. So the big impacts are on travel and tourism, public space, public events, sporting events. So you have huge economic impacts from a disease event, which are really not the cost of medicine or the cost of funerals or those costs, which are billions of dollars by themselves, but there are all these other costs. And that, once again, is just an easy way for the non-health sector to understand and start thinking about what some of these issues are and how to get them engaged. And they do want to help. So where does the environment fit in? Well, part of it I've already described to you. I'm just going to use this example from leptospirosis, which is a common bacterial disease. Once again, it's zoonotic. Most mammals can get it, and that includes humans, so there's quite a few people at risk. I'm going to go back to how I started. We can map out where leptospirosis is common. We have not so good surveillance system, but now CDC has started, as I think a year or two ago, requiring reporting in humans. Once again, there was a gap for a while. So we can start to see where leptospirosis occurs. These are laboratory test results from dogs, and on the left is PCR. So they're shedding the spirochete, and on the right is an antibody test. It just shows exposure. So we can map out, based on lab results, where leptospirosis has occurred, we think. Once again, that's how I was taught in school. So we go like, oh, those are really areas at risk in the U.S. for leptospirosis. But it's very biased, just like those EID maps. It's biased by who's doing the testing, who has money to do testing, who's interested in doing testing, who's doing reporting. Do they even have the capabilities for testing? And the publishing world too. So where are scientists, where are people looking at this? So it's a very biased view of where disease might be. So you can map this out for the world or for the United States, and you could get very comfortable thinking this is where leptospirosis is the biggest problem in the US. But if we look once again at environmental factors and socioeconomic factors, take that same group of 250 gridded databases. We have census data, economic data, education data, land cover data, rainfall data, temperature data. See which ones line up with those positive cases and what factors really fit the closest. So there's like partial dependence plots. And you do some fancy math and boosted regressions, and you find out which of those, out of those 250 variables, line up with those positive test results most likely, and then map these. Don't map the test results, map the underlying factors, and we get a very different map of the United States for risk. So suddenly these are where this is the most risk for leptospirosis, instead of where did somebody send in a serum sample for a test and pay for that? And so we get a different view. So if you compare it, we have the laboratory data on the bottom, which would be your typical surveillance data. On the left are actually where we map the risk factors. So you see a different distribution for risk. And at the right, you see where people are vaccinating, in this case, where are they vaccinating their dogs. So there's just this mismatch. So the upper map is where people have done a really good job of selling vaccines. And on the right is where people have really done a good job with diagnostic testing. And on the left are the risk factors. So we're really thinking about where's the environment on that. As you remember, the environment side was really important because it was about deciduous forest cover. There are a lot of environmental factors. There are risk factors for lepto because there's a wildlife reservoir, mostly rodents, some with raccoons, but we can't map every rodent in the United States. So you can map the habitats that are good for them, though, and so it's a proxy for some of those reservoirs. So as Frank had mentioned earlier, we have a lot of data. We don't have everything we need, but we have a lot that we can actually move forward on and start working with. So another example is this Africa Sustainable Livestock 2050. This was stimulated by USAID investing some money into looking at the future of livestock production. So that came up on the earlier panel, and about development at all costs. Let's just, more people, more food, more money. That's what we need. And that sounds like fun, but that does present some challenges. And so we're kind of working with USAID and looking at the human population growth in Africa, what that means. And there's large investments in agricultural development in Africa by many groups, some certainly by multilateral agencies, but some foundations like Bill and Melinda Gates Foundation is putting a tremendous amount of money into livestock production in Africa to meet the projected needs for this. But very few people are talking about the fact that increased livestock production, if the goal in there is to feed billions of people, then what we're doing is replicating what's happening in Asia with feeding billions of people. And so we all know, certainly many of you in the room know, that influenzas, these other emerging diseases are coming out of the livestock production sector in China. So what we're really doing and should be able to anticipate is a second epicenter for future pandemics to come out of this area in Africa if they're going to just follow in the same footsteps as livestock production in Asia. But there are things we can put into place to prevent that from happening. So Africa could potentially leapfrog into safer production rather than following the 40-year history that happened in Asia that's led to disease development. So there are things we can do if we start to discuss what that might mean. So I'm already calling it, and I went to Bill and Melinda Gates meeting a few weeks ago in Berlin and named it the Bill and Melinda Gates pandemic. Be the first one created by a foundation, which is really cool to have a pandemic named after you. They were not that excited when I mentioned that, but I thought, like, who gets a pandemic named after them? So we're just getting back to some of these same things with this livestock production, using those same principles I was giving you and digging in with the support of USAID of downscaling, so you can kind of see that big global map for hotspots of emerging diseases, but going into a country like Ethiopia and doing higher resolution and actually working with local stakeholders, the people that are going to be growing all those chickens and all those cattle, and sit down with them, the producers, and the private sector, as Dr. Bright was talking about, and engaging them and have a conversation about reducing risk up front. Now, might not prevent every outbreak, but I think we can actually reduce risk, and I think we can actually reduce the number of outbreaks, even if we'll never eliminate all of them, but I think we can actually reduce the numbers, which is an easier and cheaper step than reducing the pandemic consequences of those. And you can dig into a country, this is actually based on poultry production for a single country, and start talking about risk in poultry farms and where you can start to put your efforts early on. But I think the conversation with those stakeholders probably has more value than trying to roll out some plan and saying you need to do this by 2032. What we really need to do is initiate a multi-sectoral conversation with private sector this year and next year to start anticipating and working towards those. So I want to give you a few more slides. Also trying to get back into our environmental connections in One Health. And this is, if any of you recognize it, this is from NOAA. This is the nighttime view of Earth, and electricity uses, basically lights at night. So you can see the southern cone of South America on your up there at the top, and the right is Buenos Aires. So naturally millions of people. There's a lot of electricity. There are a lot of lights on at night. And if you ask for the view of the world at night, if you pull this off the internet, this is the view you'll get, because there's an assumption that we don't care about the ocean. So we only look at the light on land. But if you specially request the light on the Earth and not just on land, you get a very different view. And there's more light on the ocean along the continental shelf of southern South America than there is on land. And why would that be? There's a lot. It's not bioluminescence. It is not little fish that are lighting up. And it looks like this as you zoom in. And unfortunately, my animation's not working. So what you would see in the daytime, if you can imagine, every one of those lights is a fishing vessel. And there's hundreds of thousands of them, because that line of light covered over that's 1,500 kilometers, about 1,000-mile line of light on the shelf. And they're just pulling out every fish in the sea that they can get all day long and at night. At night you can see the lights. In the daytime you would see the fishing boats, but they're too small to really see. So that is just pulling out all the protein of the ocean. A lot of that goes to bycatch. And on the wildlife side, it means they have nothing to eat. Penguins, marine mammals have nothing to eat, whales, sea lions. And we're using that food, of course, for our own food, but also to feed livestock production. So a lot of that, as I mentioned before, goes into poultry feed, chicken production. So we think it's this kind of an innocuous activity of growing food, but there's a global impact on everything we're doing. So once again, the environment sector is a huge stakeholder in the future of our health, either to protect it, but also to advance it. So we mentioned, I just want to finish up here and turn it over to our panel, a few things. So it was mentioned earlier, the work we've been doing with the World Bank. So we have this operational framework. You can all download this, and it's really kind of a step-by-step guide is really designed for countries, for national governments, but also you could go at a smaller level than that, or for the private sector or for organizations. And what we're really seeing, I have to, Catherine, once again, gets the credit for doing really the yeoman's work and with the bank and producing this with the help of a lot of people, but a kind of a step-by-step guide on, depending on where your entry point is into this One Health world, kind of a how to advance that, how to move it forward. So this is kind of a cookbook or a recipe book for that, but also a discussion book and how to really stimulate some of these conversations and how to get moving forward on that. In there is kind of like, where does One Health fit in? Because it's kind of a confusing world of international and national policies and guidelines and funding mechanisms. So the team really made an effort to help countries and help individuals navigate through that and give them a map about how they can get engaged with One Health and what the next steps would be for them, where they could start and where they could move along, and try and decipher some of the confusion. Because as people have mentioned this morning, One Health can be many things. It's a big morass. It's a very complex set of dynamics that are interacting. And it can just be intimidating. So as we talk to people around the world about starting with this, they often say, we don't know how to begin. So that's what this book is about, and you can download it. The other work is what's been missing in some of these assessment tools is there's a good one now with the joint external evaluation. So those of you familiar with public health and WHO and the GSHA, we have the joint external evaluation tool, which kind of comes in, and countries can use that to identify where they might have gaps. It's very oriented towards public health, but there's a companion process with the World Animal Health Organization for the PVS, the Professional Veterinary Services Pathway. It's actually been running up and running longer. So on the agricultural health side, there's tools for countries to use. And what the bank has been asking for more recently is a third leg of that stool, the other third of One Health, to make it really One Health, on the environment assessment side, environmental health, and what needs to be done. So a country, when they go to the World Bank, so earlier when Dr. Bright said, I'm hoping the bank would take leadership, and I was going like, yeah, me too. I think there's some potential, because these kind of tools are what countries would be using when they go to the bank and talk about funding mechanisms, and they say, great, but show us your JE, show us your PVS, show us your environmental health assessment tool, and then we can talk about what your funding needs really are. And so I think we can use that to change the future there. And then finally, in addition to economics being a big motivator, and sometimes I'm embarrassed in a health conversation to say it's about money, but it is often about money. So I think we just have to accept that reality. So I think the financial argument's really good to support the One Health efforts. And the other is biosafety, biosecurity, and just security in general. So out at the table today is kind of a pre-release copy for all of you to look at on some aspects that we were looking at. And it's this book, Building Resilience to Biothreats. And really thinking through that process, prevention, not starting with detection and response, but really talking about prevention. Once again, this is a really thorough study to look at gaps in biosecurity and biothreats. And two of the big gaps were not a strong enough links with the security sector and not enough strong enough links with the environment sector. So this meeting today is just kind of an example following through with the findings of this report of the importance on the environment sector being engaged and the security sector being engaged across that spectrum of activities. So I want to close there. I think we'll get our panel to come up. It's great. Thank you very much.
Thank you very much, Dr. Karish, for those enlightening remarks. I think they really set the stage for our panel this afternoon, adding seats at the One Health table, promoting the environmental backbone at home and abroad. I am Ellen Carlin. I'm a Senior Health and Policy Specialist with EcoHealth Alliance, and I'm delighted to introduce our next panel. We have Asaf Anyamba, Jonathan Sleeman, Bruce Roden, and Lauren Herzer-Reese. So in the interest of time, I think we will get started with Dr. Anyamba. Dr. Anyamba is Senior Research Scientist with University's Space Research Association at NASA's Goddard Space Flight Center. His research interests are in the extraction of climate variability signals associated with El Nino, and his work supports research for USDA, DoD, and others. Dr. Anyamba, we look forward to your remarks.
Yeah, thank you. While I'm not here specifically speaking on behalf of NASA or USRA, I think it's safe to say that I can inform you guys that NASA's Mars Explorer landed successfully. Thank you very much, Eileen and Bill, for inviting me to this session. I didn't know what to expect, but I think now I know what to expect. I will talk about about 4 points, and basically is regarding the work I do. The first one, I would say that the laboratory within which I work at Goddard Space Flight Center is called Biospheric Sciences Branch, and I'm in a research group there called Global Inventory Modeling Systems Group. We actually specialize in producing maps of vegetation from satellite measurements globally. We now have an archive of about 35 years of data every day. So that is a lot of data. But the most important thing that we do is we collaborate with other government agencies to develop applications that answer particular federal government needs. To that end, one project that I have been working on for a long time, about 20 years now, is a project on Rift Valley monitoring, risk mapping, and prediction. Bill had mentioned about that. I would say that now looking back, I was doing One Health before I knew I was doing One Health. So Rift Valley fever is a crossover pathogen affecting both animals and human beings. One thing I can point out that in doing that work, we are supporting primarily the Department of Defense, Department of Defense Health Agency, Armed Forces Health Surveillance Center, through their unit called Global Emerging Infection Surveillance System, GUIS. I think if you live in the Washington, D.C. area, it's important you understand all these acronyms. Otherwise, you won't get your work done. So what we do in that, we provide information to them every month, providing them risk map of areas where potentially Rift Valley fever could emerge. That information is basically used for force health protection, in that many of our men and women who are deployed overseas, whether they are civilians or military, need to understand the risk of emergence of particular diseases in particular location. So that information goes into fulfilling that need for them. However, on the other hand, we are charged with making sure there is international interoperability in the decision-making chain. So given that Rift Valley fever is a crossover pathogen affecting both humans and animals, we also provide that information to Food and Agriculture Organization of the United Nations, FAO, which covers the livestock health. We also provide information to WHO, World Health Organization, which is in charge of human health. And more importantly, and I think Billy would be glad to know this, we also provide that information to OIE, the World Organization for Animal Health, which is basically, I would say, quasi-regulatory agency for trade in livestock products. The impact of this is in 2006-2007, we actually had the first prediction of Rift Valley fever outbreak in East Africa. And then following that, we had other predictions for Sudan, and Southern Africa from 2008 to 2011. The important thing we came to understand in doing this modeling activity is that we had different performance in different regions. So most of our success was based on the findings in East Africa. However, we didn't have as good performance in Sudan or in South Africa. This required digging deeper. And now we have a project that we are conducting together with Billy Koresh in South Africa that is looking at all aspects of the Rift Valley fever paradigm. We are looking at the climate, we are looking at livestock, we are looking at humans, we are looking at wildlife. And in doing so, the most important thing or significant thing from my side is to understand under what conditions actually the emergence happens, and critically, what is the immunity? Because in my thinking, the immunity conspires with the climate to drive outbreaks. So that is the work that we are currently doing and trying to answer that question. The second application we are working on is in cooperation with the USDA Foreign Agricultural Service. We are providing them with satellite information every 8 days. This information is used basically to feed into their models to figure out what are the estimates of crop production for different products globally, be it soybeans in Brazil, wheat in Australia, wheat in South Africa, corn in South Africa, wheat in the former Soviet Union, wheat from Canada, different commodities. This information is important because this eventually, the numbers that USDA produces are used to drive the prices of agricultural commodity products on the world market. So you can think of it that we are providing what I would call unbiased information that is helping USDA in terms of estimating the production of various commodities. However, at the same time, we are also providing this information. We are also looking at areas where there are going to be shortages, because where you are going to have shortages, or in cases where you have drought, you basically are going to have nutritional deficiencies. If you have nutritional deficiencies and then you have an outbreak, at the same time, you are talking about those kind of population in those areas that are nutrient deficient being hammered a lot because of an outbreak. So that is another project we are working on. And then the other thing that I want to mention is the whole idea of data. Billy mentioned, because I'm working at a federal government agencies, we have a lot of data on the environment. And I would say that in my estimation, I don't think this data has been exploited fully to answer a particular question about human health and and the environment. So basically this is required is collaboration between different disciplines. So we have to have a multidisciplinary approach in dealing with these areas. So for example, on the Rift Valley Fever project, even though my training is in geography and remote sensing, I'm not doing this work alone. I'm collaborating with vector entomologists. I'm collaborating with people who do climate from NOAA. So you have to have a collaboration between different disciplines in order to be able to answer specific questions. The last point, and this is maybe my own personal perspective, is regarding extremes in climate, because as all of you understand that the report that was released recently about climate, my biggest concern is for extreme events, because we have seen this year, and maybe not many people know that, there was an outbreak of Rift Valley fever in East Africa in the spring. This is basically, this outbreak happened outside the window when the outbreak is supposed to happen. The outbreak is supposed to happen between November and March. This outbreak happened between May and July. And it was it was outside that window. It was an extreme event. That area received about 500 millimeters of rainfall, excess rainfall, in about 2 months. So the issue is with these extremes happening, like we have seen with the hurricanes hitting Texas, hitting Florida, hitting South Carolina, North Carolina. What are the consequences of these extremes? I think at this point in time, we actually cannot say that when you have a particular magnitude of an extreme event, say 400 millimeters, you are going to have a specific scale of an outbreak. So this is a question that is really I'm concerned about, and that's really bothering me about in terms of understanding the extremes, the impacts of extreme events on disease outbreaks. Thank you.
Thanks for setting the stage for the conversation. I think you're living the interdisciplinary and multi-sectoral paradigm that we want to support. So thank you for those remarks. We'll turn now to Dr. Sleeman, who's the Center Director for the USGS National Wildlife Health Center, where he investigates and researches wildlife diseases. His interests include development of national wildlife health programs in Asia, wildlife disease risk assessments, and leadership skills in wildlife health. We look forward to your comments.
Great. Thank you very much for the introduction, and thank you for the invitation to participate in this panel. It's been a very fascinating afternoon, I think very rich discussion. As was mentioned, my home institution is the National Wildlife Health Center. We do research and investigation on wildlife diseases. We have historically focused on diseases of conservation or wildlife management concern, but have been increasingly expanding to do research on diseases across sectors, things like West Nile virus and avian influenza. With apologies to Casey, we sometimes call ourselves the CDC for wildlife, to help help convey the sense of mission. And Dr. Bright very kindly invited you all to my home institution. Just don't all come at once. And I highly recommend coming in the summertime. Madison can be quite cold. Anyway, I'm going to touch upon various points. I'm not going to talk too much about the work at my center, but talk a little bit sort of bigger picture regarding the wildlife and environmental health sector, and sometimes how we feel somewhat neglected when it comes to One Health, some of the successes that have happened, and some of the approaches I think that could be taken to help improve that integration, and how that can, I think, be beneficial overall to the One Health objective. I think it's increasingly clear and accepted that human societies and communities cannot thrive in the face of biological impoverishment and the degree of degraded environments that we currently live in. There are a number of very good examples of the protective effect of healthy environments and healthy wildlife. Intact coastal mangrove swamps and coral reefs do protect against extreme weather events like hurricanes. They can provide protection to those coastal communities. We know that biodiversity can buffer against infectious diseases, and they can provide very important ecological ecosystem services. So, for example, the USGS did a study several years ago that showed that insectivorous bats contribute up to $50 billion to the U.S. agricultural economy annually through the insect control services they provide. These are species we now are currently losing as a consequence of an emerging disease called white nose syndrome, which is a very unique fungal infection that we think was brought over from Europe accidentally by cavers introduced into a cave in New York, and is now in over 25 states in the U.S., and a loss of up to 7 million insectivorous hibernating bats. I think, as been mentioned by previous speakers, One Health, I think, is a very useful intellectual or a concept or framework on which to address these issues of mutual concern. By definition, One Health is collaborative, it's multidisciplinary, and it's also aimed at looking for optimizing outcomes for humans, animals, and the environment. I think, though, as I alluded to at the beginning, I don't think One Health has always achieved those noble aims or goals, although there are increasing success stories. And I think one of the challenges is what was mentioned earlier, is that One Health is somewhat of a broad church. It can mean a lot of different things to different people. People are often working on different priorities. Some of those priorities may be competing, and it's very difficult to collaborate when you're working on different priorities and different objectives. And I think That can be a big challenge, especially when interventions or outcomes devised for one sector, like the public health sector, may have unintended consequences for the environment or the wildlife sector. So I think that kind of my first point I'd like to make is that from the business literature, we know that organizations and entities that have a clear mission, vision, core values and goals and objectives are far more successful than those that do not have those established. And I would advocate for a global agreement regarding the definition, the core values, and the mission, and the goals of One Health. We have a very good example in the Sustainable Development Goals by the United Nations. They have 17 different goals, 169 identified targets, each with specific metrics, each integrated amongst all different goals, and clear articulation of the importance of environmental integrity, the achievement of these goals. And I think if we move towards this common understanding of what One Health is and its values, will help with the integration of the environmental sector into the overall effort. So, for example, if we had a core value that articulated the value of biodiversity, the value of environmental integrity, that'll go a long way to ensuring it's considered when interventions are devised regarding whether it's development of livestock in Africa or whether it's other public health interventions. I just want to turn to my little graphic here. Some of you may be familiar with the health impact pyramid. It was devised by Tom Frieden, the former director of the CDC, published several years ago. We have cheekily modified it and called it the One Health impact pyramid by adding the environmental factors to the base of this pyramid. And the basic premise is that the further you go up the tip of the pyramid, the easier it is to achieve those goals, but the less impact you have at a population level. So advocacy awareness, clinical interventions, they're very effective on an individual level, but less effective on a population level. The further down you go down this One Health impact pyramid to the socioeconomic and environmental factors, the broader impact you'll have with your interventions, but the much more challenging it is to achieve those goals. And I think the nice thing for me about One Health is it forces us to think and forces us to act at the base of this pyramid. And really, as has been mentioned previously, socioeconomic and environmental factors very much underpin the health of all. And this is where we need to focus our actions and focus our interventions and focus our outcomes. So how do we do this? And it's been alluded to by previous speakers. For me, there's a couple of approaches that we need to look at taking. It's already mentioned the idea of a systems approach, looking at the system holistically, looking at the system inclusively, thinking deeply and thinking broadly regarding those interventions that we devise, ensuring you include the potential impacts for these other sectors. And I'll give a little example here in a second. The other, I think, approach we need to take is we often get paralyzed by the lack of data or information. We don't want to take action unless we're certain about the outcomes. I would very much advocate for a harm reduction approach, where we take pragmatic, practical actions, even in the face of uncertainty, and ensuring that we don't ignore a problem just because we don't have the full data available to us. So to illustrate those, I think one of the things we've been working on a lot at my center is highly pathogenic avian influenza. As you know, or some of you may know, we had a large outbreak in 2014, 2015 in the United States. It was the largest animal health emergency ever recorded. Over 3 billion $3 billion US were lost as a consequence of the infection in the commercial poultry sector. We know these wild birds can transport these viruses over large distances. They're often blamed for these outbreaks. There's often calls for culling or population reduction of wild birds or destruction of habitat to reduce these populations, which clearly is going to help the poultry industry, but not necessarily help the wildlife sector. But what's been interesting is over time, thinking has changed. Again, taking this sort of pragmatic approach, taking a harm reduction approach, taking a systems approach, where the focus now is increasingly on on-farm biosecurity as the most important point of control for these outbreaks, where it allows both wildlife and the commercial poultry sectors to coexist in the same environment. Another very good example is several years ago, there was outbreaks of Marburg virus, which related to Ebola virus, in caves in Uganda. They did some studies to show that the fruit bats, the Egyptian fruit bats residing in these caves, were a reservoir for this virus. When the local populations were informed of these results, they went in and depopulated these caves. They decided they couldn't coexist with these bats. Subsequently, though, these caves have been repopulated by new bats. It's empty habitat. Wildlife very often take advantage of new habitat. They went back in and sampled the bats and found out that they had a higher prevalence of Marburg virus than the previous population. So not only have you not solved the issue, you've actually made the problem worse, as well as harmed the wildlife sector. So again, looking at it from the base of the One Health impact pyramid and taking a systems approach, the reason that people access these caves is for economic activity, for mining and other types of activity. Well, a potential solution would be to look for other economic alternatives, economic opportunities for these populations, so they don't have to indulge in this riskier occupations like mining in these caves. It can focus on another type of economic development, again allowing humans and wildlife to coexist. I think the final point I'd like to make, and again it was touched upon by other speakers, I think in order to facilitate good One Health collaborations, we need that good governance and those leadership skills. We need equity, so people have an equal seat at the table, no matter what their political clout is, no matter what the resources are. We need transparency to ensure that decisions made are clear, building upon a foundation of trust. And we need to ensure that we're looking for mutual benefits, and so we're always looking for those win-win solutions in whatever problem we have to address. And I think a very good example of that on a committee I've been serving on is the Interagency Committee for Surveillance for Highly Pathogenic Avian Influenzas in Wild Birds. It has representation from the CDC, the Department of Interior, USDA, and US Department of Agriculture, as well as the state agencies through the National Flyway Council. This committee has been going for a little over 10 years now. It coordinates the surveillance for these viruses in wild birds. And I think it's been a really good example of bringing these different sectors together, where initially it was some sharp elbows and mistrust. Well, over time we've gotten to know each other, we've got to understand each other's perspectives, and gone from trying to push our own missions to supporting each other in each other's missions. And this work has facilitated the CDC to get access to these viral isolates so they can assess them for public health concern. It's provided early warning of the potential risks to the commercial poultry industry so they can take preemptive actions. And it's provided scientific data regarding the role of wild birds in the movement of these viruses, so decisions can be evidence-based and science-based. So in conclusion, I would advocate by focusing on the base of the One Health impact pyramid, by taking a systems and harm reduction approach to our work, and ensuring we have good governance and leadership skills. It will help to integrate the environment and wildlife health sectors into One Health and help One Health truly realize its full potential. Thank you.
Thanks, Dr. Sleeman, for bringing us the wildlife health perspective, and also for your image, which I think really gets at the premise that if we gear ourselves toward the environmental backbone, we can actually get toward preventing outbreaks from happening rather than having to respond to them at great cost. I'd like to introduce Dr. Bruce Roden. Dr. Roden is the Associate Director for Science for the Office of Research and Development. He comes there after 6 years at the White House, Office of Science and Technology Policy. He initially came to EPA as a fellow with the American Association for the Advancement of Science. And I can't seem to sit on a panel in DC without meeting another AAAS fellow. I was one as well in 2007, and I know we have at least one or 10 here in the audience, apparently.
Okay, so thank you. So hi everybody. I also have to say, what a great panel. We started off with, almost you've sort of answered my sort of thesis here by starting off with health and Rift Valley fever, going into wildlife, and I'm going to be going into sort of the environment side, looking at the bottom end of that graphic. And you're also going to get a lesson in different variants of the English language from different continents. I don't know where it's going to end up. It'll be interesting.
Back in the US, yes.
So yeah, I'll talk slowly. I'll try and upgrade my accent a little bit more clearly. So yes, I'm the Associate Director for Science at EPA's Office of Research and Development, just over in the tower over there. I'm serving currently as the Deputy Assistant Administrator while we await a political appointee. I come from a medical background as a physician, and frankly, always had a passion for ecology. And the interesting part of coming to One Health is I'm not the first physician to ever have that passion. And in fact, if you go back, for the people around here who know, Carl Linnaeus was a physician and botanist. And in fact, I did a lot of volunteer work when I first came to Washington years ago on big leaf mahogany and small leaf mahogany. And it turns out that they were named by Nicholas Jakin, who was another physician botanist, after their friend Gerard van Swieten, who was a physician as well. So there's a long history of doctors dabbling in all kinds of other stuff. So it's no difference coming into One Health. So I'm glad to be here. It's an interesting conversation for us to have at EPA and amongst you all, even today, regarding what's EPA's role on One Health, and it's a bit different, sort of a different way that we would include, or that we do include, ecosystems and that One Health objective and the interrelationships in what we do. And I was thinking over the weekend, and I've heard it again today, what's different about EPA compared to CDC, etc. And so it flows with the way this panel flowed. We hear a lot about infective illness, and we all know influenza and the role of animals in influenza pandemic, swine flu, avian flu, etc. Ebola, again, similar sources, lots of things going on over the last few years. EPA's had some role in those things, but the core of the response is usually HHS, CDC, state government, etc., and the public health service in response to that. First role, the overt relationship of infective illness and One Health. I was thinking, where does EPA start coming in here, even more so, overt illness? And so, yes, sort of the second tier. We do have a role when it comes to harmful algal blooms and red tides, and I'm thinking back to the days when I was a scoutmaster, and it's like the instructions were, if you want to drink that water, it's good to have some critters swimming around in it, because that means it's probably okay to drink, but if there's no critters in there, it's probably not a good idea to drink that. So there's those acute things, same thing with dolphins dying. If the dolphins are dying off your coast, it does make one think about, maybe I shouldn't be out there in that red tide. And then we have antimicrobial resistance as another, sort of that overt problem that's fairly visible. So one, infective illness, overt illness, but really where I'd like to take activities, but it's a bit difficult, is on the chronic illness side. And I'm thinking, the big illnesses we have now, obesity, depression, diabetes, these are all somewhat resolvable by increased green space, parks, bike trails, etc. EPA has authority in those areas, but really no specific mandate. So much interest, but not a specific mandate. So that's where we have these junctions with One Health, is like all those things are of interest to EPA, but we get to the idea of how do we come at this from a different direction? I think just this panel is the three different directions. We all go to the same interface between health, environment, and wildlife from different directions. And so let me talk about the EPA direction here as we see it in research and development. First of all, we really do at EPA what Congress orders us to do through our authorizing statutes. Clean air, clean water, clean up the land, resolve Superfund sites, take care of toxic chemicals, etc. Those are our mandates to do activities. But one of the ways to get at that from the One Health perspective is through ecosystem services. So it's not quite the same as if you've got pandemic flu, etc., or avian flu, but it's another way, a lens that we can look through our EPA mandates to address this interface between environment, critters, and human health. I'm going to inflict a bit on you here. This is sort of an experiment at your expense. Maybe mine if I get shoes thrown at me. So ecosystem services. Let me just ask you all for a second. I won't dwell on this. It is a bit of an experiment. I know some people are probably very familiar with the concept here. Some people aren't. But we're in a room here and I'm not seeing much ecology around me. I'm not even seeing a fake plant. But let's close your eyes for a second and think about the last drink you had. You had a drink of water somewhere and trace the pipe out of the building, through the water treatment up there where my car is parked currently, and then into the river and the rainfall that sourced that water. So think of that pipe. Think of the last time you went to the bathroom. Another pipe goes out from the bathroom out to the environment, to Blue Plains here. bugs and critters in the water, taking care of the effluent, and into the river and taking care of nature. Same thing with the air. The fresh air we're breathing is coming from the outside. And I'm not going to get too I haven't got my hippie outfit on here, but let me just, if you take away the walls of this building, that is the foundation. Same with food. The food, it doesn't come from a store, it comes from a farm. It comes from the land. And so if you take away the walls of this building, we all are completely dependent fundamentally on ecosystem services delivering those clean air, clean water, good food, etc. So that's one of the ways but it's a bit of a mind trying to get around that because we're so used to these walls around us. We take them away three-dimensionally. You see all these pipes to the things from the ecosystems that are actually keeping us all going here. So I won't dwell for too long on that, but when we talk about how do we implement this broader vision at EPA, we're going to have to use the congressional mandates that we have, air, clean water, safe drinking water, etc. Two ways to do that. Health impact assessment is one way to really start that conversation going, and benefit cost analysis to bring in those ecosystem services and the values around us. I just want to emphasize that that's not just about dollar bills. It's actually a process. So if you want to really operationalize health impact assessment or benefit cost analysis, you have to sit down and go right back to the communities and say, what is it that you value about your world where you're living and your decision making? So if you use the process at the front all the way through, you get these better decisions and people start valuing the ecosystem services and the ecology around them. So that's one way that we actually operationalize this interface at EPA. And I won't dwell too long because give me a microphone, I tend to grab it. And no microphone. But tools. So we have some really useful tools or sort of databases at EPA that people can go to. The Enviro Atlas is one of them. It's a really useful tool, and if again thinking about this flow from ecology through to the tools we can use. When I was at the White House, we developed ecosystems.data.gov. So in fact, it started off with bison at USGS, and then we had the crop land cover maps, and we thought, well, let's add Enviro Atlas, which goes sort of, it's more than just, bison is critters. Where are the critters? Where do the bison live? Where do the eagles live, etc. Land cover is essentially what is the land cover. But the Enviro Atlas takes us right up to human communities. So it follows that from the ecology through to land cover, through to use of the land, through to human communities as well on that land. So it's a really useful database in that perspective. It's geospatial, etc. Very useful. We also have a report on the environment, a way to sort of collaborate. This goes back to Christy Todd Whitman when she was EPA administrator. She really wanted to have a database that sort of said, how are we doing out there in the world on a lot of these metrics? So EPA has been collating over the last, 15 years or so, all the metrics for how we're doing the report on the environment. Another really good way to coordinate this information. And maybe I'll just leave it at that and not yak for too long here. I just want to put a plug in that under the Lautenberg Act, we've also been asked at EPA across the board through the Toxics Office and through research and development working closely together with NIHS and HHS to reduce the amount of vertebrate animal testing in research. So that's a really good activity. Just wanted sort of a bit off the side, I think, but it's something really, really worth looking forward to, reducing this use of animal or vertebrate testing in research. Anyway, thank you.
And to think that Dr. Roden told me he didn't think he would have anything to add to today's discussion. Sorry we don't have more time. We're going to move on to Lauren Herzer-Reese, Project Director here at the Wilson Center in the Environmental Change and Security Program. Lauren previously served as Crisis Corps volunteer with the Peace Corps and FEMA in New Orleans following Hurricane Katrina. We look forward to hearing from you.
Thank you. I want to thank the organizers for including me in the discussion. I can say that because I'm at the Wilson Center. But this is actually my first foray into One Health. So I might sound a little different from my colleagues here, but I'm learning a lot, and I'm really appreciative of being part of the conversation. ECSP has a long history of working across sectors, but I also tend to find that in our conversations with folks from the environmental, international development, security sectors, there's often an acknowledgement of the health risks connected to the issues that we're discussing. But there's a very clear need and opportunity to better include health experts in those conversations. So I'm grateful to be making the connection with all of you here today. One area where we've been focusing our efforts to better understand the links between environment, health, and security is looking at the impact of climate change on the movement of people and corresponding health impacts. There were 258 international migrants in 2017. 66 million of those were forcibly displaced as a result of conflict, violence, poverty, or extreme weather events. There are about 40 million internally displaced people. These are people who have left their community but remain in their country of origin and under the protection of their government, for better or for worse. UNHCR considers these people to be among the most vulnerable in the world because they are often difficult to access for humanitarian relief. Displacement as a result of weather-related impacts is growing, now represents a significantly larger number of IDPs than those associated with conflict and violence. So in 2017, there were about 19 million IDPs as a result of disasters, compared to about 12 million as a result of conflict and violence. And as we saw in the National Climate Assessment, which has been alluded to, was released on Friday, it reaffirms that climate change will continue to increase the severity and frequency of extreme weather events. So there is relatively broad consensus that climate change will lead to an increase in more migration. So I do, though, want to make a caveat here that migration is a complex phenomenon, and it's very difficult to point to a single cause in a person's decision to move. There are, in addition to the environmental factors, there are political, social, demographic, and economic factors, and all of these interact in a way that influences a person's decision to move. That being said, climate change on its own is expected to increase morbidity and mortality via its effect on freshwater availability and quality, for the stability of infectious disease patterns, air quality, and among other things. These, in addition to extreme weather and heat events, will push people to move to places perceived as offering better opportunities. So I thought I'd quickly outline 3 categories of where we expect to see health impacts related to climate change and migration. And here I'm drawing on research conducted by long-term friends of ECSP, John Burnett at the University of Melbourne and Maxine Burkett at the University of Hawaii. The first category is forced displacement, which is what we see in the event of major environmental deterioration and disasters like floods, famines, and hurricanes. The health outcomes from this type of event are similar to those of what we see in refugees in the early stages of movement. You might find overcrowding in camps, poor ventilation, inadequate water, shelter, sanitation, and access to health facilities. Health outcomes from these conditions include things like measles, acute respiratory infection, increased risk of water and food-borne diseases like cholera and dysentery, and vector-borne diseases like malaria and dengue. There are also the unanticipated effects of poor planning and management in response to large population displacements. We saw this in Haiti following the 2010 earthquake, when UN peacekeepers unintentionally introduced a major cholera outbreak that resulted in the deaths of nearly 10,000 people. The second category I'd point to is planned relocation and resettlement, which, despite the calming presence of the word planned, is actually associated with poor mental health, food insecurity, unsafe water supply, inadequate sanitation or sewage systems, and increased infectious disease. Malnutrition is often an outcome of resettlement, as households are find themselves in new environmental, social, and market conditions that they are not prepared to navigate. The third category is migration to urban centers. So as people move in response to climate-related impacts, the movement will most likely be within countries and to cities. Cities in the developing world are ill-equipped to welcome the rapidly growing populations that they're experiencing, and many of the urban poor end up in informal settlements in the periphery of those cities. They suffer from crowded conditions, a lack of infrastructure and access to health services, and poor water and sanitation facilities. The informal settlements also tend to be on vulnerable geographies like low-lying plains, coastal zones, or on unstable slopes that leave the populations physically exposed to further climate risk. And finally, a common stress across all 3 categories are the impacts on mental health. These are widespread, felt at the individual level as well as the community level in both the pre- and post-displacement periods. They can include increased trauma and shock, PTSD, substance abuse, and depression. Following Hurricane Katrina, research found that among the sample population affected by the hurricane, suicide and suicidal ideation more than doubled, 1 in 6 people had PTSD, and nearly 50% of people living in Katrina's path developed anxiety or depression. Additionally, it was found that domestic abuse, domestic violence, and child abuse increased in homes among those affected, increased among families whose homes were affected by the storm. So I want to end on a positive note, because that's all very bleak. Migration is not just a risk, it is a very important and valuable adaptation strategy. So the question is really, how can we bolster resilience in vulnerable communities so that people have a choice on whether or not to move? And what kinds of policies and programs can be instituted in the receiving communities so that both the migrants and the receiving communities are able to benefit? And finally, along those lines, how can the international community develop policies around migration that contribute to effective climate adaptation and also healthier communities? That's it.
Thank you so much for that. I think we could have an entire panel just on climate change and migration right
We
now.
have, and we will have more. Yes, absolutely.
We're over time. Do we have time for a few quick questions and answers? Okay, I'm going first. Then I'll call on you, Joe. Oh, I have so many. Okay, real quick. This might be a good question for Dr. Anyamba and Sleeman, but anyone can answer. So I'm really interested in this idea of prevention, and I think your pyramid got at it, that we work at that top point of the pyramid or at the margin, where you can do advocacy or create a countermeasure to fix something, but that's after it's already happened. So maybe if we focus more on the environment, we can get at this idea of prevention, which through a lot of the work we've been doing, we're finding is very much forgotten and largely ignored compared to huge costs of response. So how can we get better at acting at the base of the pyramid? And also with respect to Dr. Anyamba's point about the treasure trove of data that exists, how do we get at those data in multi-sectoral, interdisciplinary fashion and create partnerships that can really see what those data might mean for One Health?
Well, I think that they're linked, and I think for me there's two strategies that I can think of to help us focus at the base of the One Health impact pyramid, and it goes to what Billy was presenting is to generate more studies that are forecasting what the issues will be in the future, where they will occur, and provide some data for policymakers to start to focus action on those areas where we think, or those issues I think are going to emerge in the future. The other thing that I've noticed is getting data on the sort of economic impacts of the prevention. The more that we can have data that shows the cost savings from those prevention and compare it to the costs of an actual outbreak, I think the more successful we'll be in implementing some of these solutions. A very good example is the current vaccination campaign to control rabies, actually here on the East Coast in the United States. Did a very good economic analysis to show it was more cost effective to vaccinate the raccoons here on the East Coast to prevent the further spread of rabies versus the costs of the prophylactic treatment from rabies exposure. So to me, it's the data and the data on kind of the forecasting, the data on the economics.
Anyone else? You don't have to answer. I thought you might be interested.
Yeah, I think if you look at, for example, and I'll provide an example of Rift Valley fever, understanding the environment and the climate is very important because in most cases you almost have a 3 to 4 month period before an outbreak occurs since an event starts. So if you think about it, having climate information is actually right now enabling us to move the response line to the left. In that, where possible, you can do early animal vaccination. If you do that, you basically minimize the chance that you are going to have activity in humans. The more expensive parts will be to know where exactly to do vector control. If you do vector control, you minimize the chance of an outbreak in livestock. and further minimize the chance of an outbreak in humans. So I think understanding basically the environment and the climate and what it's doing, that can really help us in terms of moving the response line in terms of prevention further to the left. Instead of waiting until an outbreak occurs in human beings and then we are using humans as sentinels for an outbreak event. And I think there are many cases, for example, in the map that Billy had shown earlier on, there are many examples of those instances where we know there is a link between environment and the climate, and we can use that information in order to undertake prevention measures.
Thank you.
Yeah.
Before I turn it over for an audience question or two, I did just want to remark on the migration and climate change piece, and maybe it's just more of a comment than a question, but you know, having taken a look at the National Climate Assessment and listening to some of your remarks, it just starts to seem obvious that the places where, you know, we at EcoHealth Alliance look at those maps that Dr. Karish described, that risk factors for emergence events of infectious diseases are the same places where there's economic instability, where the impacts of climate change may be greatest, where there's political instability, and where the origins of many of these migration events are happening. And so since there's so much investment going into many of these nations from the health community and from governments who want to invest in public health in these nations, I mean, maybe there's a way that we can actually leverage that investment toward investment in environmental health and other types of you know, ecosystem investments, and the sorts of investments that might positively impact or prevent climate change.
Yeah, I mean, I would just, yes, absolutely. I think that there's definitely a growing understanding and effort to realize co-benefits across sectors in approaching these issues, right? And so, I mean, even USAID has with the reorg, they've, you know, moved the Bureau for Food Security into a resilience. I don't want to misspeak, but I think resilience is aligning with food security and water, right? And so they're understanding that you can't have any of those things without the other. And I think that the health component is one that comes out strong as well. So I think that we always use the term co-benefits and the importance of minimizing unintended, that's a hard word for me, unintended consequences while realizing co-benefits by working across sectors.
Thank you. We have time for one question, and I promise that to Joe. All right.
We have a microphone.
Coming up.
Yeah, I'm Joe Dudley. I work for Livestock Incorporated. I support programs for DTRA and the Department of Health and Human Services. I wanted to point out, in the spirit of the water analogy, if you look at the bottles of water on your desk,
Yeah, Fiji, I noticed that.
notice where those came from and why they're here, why they were sent here from where they came from. The other point comes back to the transparency point that Jonathan Sleeman raised, and this also goes back to Billy's point about pig's fly and African swine fever appearing in Belgium and now China. Which also harks back to the H5N1 and H5N2 highly pathogenic avian influenzas. It is very difficult for governments to acknowledge that there are supply chain issues that drive disease outbreaks in commercial livestock and poultry sector operations. The reflex is always, it's the wild birds, it's the wild boars, when the data patently says otherwise. This greatly hinders the interest and ability of the global community to both detect and respond to disease outbreaks in livestock and poultry populations and human populations, because in many cases, because of this denial syndrome, the humans end up being the canaries in the coal mine. Is the humans are the first indicators to the public that there's anything going on in the animal. And we've seen this in many instances where the first indicators are in the human populations. And this is sometimes due to the fact that the surveillance programs are in place, better surveillance is in place in the human populations. And in other cases, it's because the information suppression is stronger on the animal side. So I think the point with transparency is extremely important, and that this is a factor that we really need to work on, as well as detection. It's the reporting piece, to encourage people to report and not play the smoke and mirrors games that can interfere with the control and effective response operations.
Thank you. Any responses? With that, I think I'm going to turn it back over to Alex. Unfortunately, we have run out of time for more questions, but Alex is going to give us some guidance on what comes next.